Huntington disease is an autosomal dominant disorder that is caused due to mutation in the Huntington gene, which is located in chromosome 4, as a consequence of which there is expansion of CAG trinucleotide repeats, and CAG stands for cytosine, adenosine, and guanine. Consequently, due to the presence of these protein aggregates, these patients present with choreiform movements, psychiatric problems, as well as dementia. Other findings that you will see include caudate, as well as putamen atrophy, and the neurotransmitters that will be affected include decreased levels of acetylcholine as well as decreased levels of GABA. So the kind of mnemonics that you can use to memorize some of these findings include HUNT for food. So Huntington gene is located on chromosome 4, and then the other one is CAG, which stands for CAG trinucleotide repeat and goes for atrophy of the caudate, decreased levels of acetylcholine, and decreased levels of GABA. So again, CAG goes for caudate atrophy, decreased acetylcholine, and decreased GABA. Now, if you're asked on the exam to identify what parts of the brain are atrophied in these patients, I would like you to know that it would be the caudate, as well as the putamen. One other important concept that I would like to discuss with you is called anticipation. So what happens in males that have Huntington disease during spermatogenesis? Since there is increased number of cell divisions, these CAG repeats will expand. So there is expansion of CAG repeats, as a consequence of which the age of onset in subsequent generations would be earlier. So earlier manifestations of symptoms. So just for argument's sake, let's say that we have a male patient that had the symptoms start at around age 50. Now, if this patient has some children, due to the expansion of the CAG repeats, the age of onset will be earlier. And for instance, you can say maybe around 40, these patients will start to manifest symptoms. And this process is referred to as anticipation. So let me explain these findings through this image. So here we have a normal Huntington gene that contains 15 to 32 CAG repeats. Now, if due to mutation these CAG repeats go over 38, then there would be Huntington disease. And in males that have Huntington disease during spermatogenesis, these CAG repeats keep expanding and thus their number increases. And this process is referred to as anticipation because the age of onset in future generations would be earlier. So for instance, if this patient had Huntington at around age 50, the next generation will have it earlier, like maybe 45 or 40. And that concludes our discussion.